Hello and welcome to Scientific Talk. What if you could build muscle, strength and endurance without lifting heavy weights? Sounds too good to be true, right? Blood flow restriction, or BFR training, is changing the game for athletes, fitness enthusiasts and even rehab patients. BFR training is an innovative method that has gained attention in both athletic and rehabilitation settings. It involves partially restricting venous blood flow from a working muscle while allowing arterial blood flow. This is achieved using specialized cuffs or elastic bands applied to the limbs. By restricting blood flow, BFR creates a hypoxic or low oxygen environment in the muscles, mimicking the effects of high-intensity training even at low loads. This technique offers a promising alternative for individuals who are unable to lift heavy weights due to injury, age, or other constraints. The concept of BFR originated in Japan in the 1960s with the development of the Katsu method, which directly translates to additional pressure. Since then, it has evolved with advancements in equipment and scientific research. Today, BFR training is utilized by elite athletes, physical therapists, and recreational gym-goers to enhance performance and recovery. The hypoxic environment created during BFR training triggers several physiological adaptations, even when using low-intensity loads. Key benefits include 1. Increased muscle hypertrophy and strength. Studies show that BFR training stimulates muscle growth comparable to traditional high-intensity resistance training. For example, a study in 2010 found that participants experienced a 20% increase in quadriceps size after 8 weeks of low-load BFR training, meaning 20 to 30% 1 rep max or 1 RM, a result similar to high-load training at 70% 1 RM. 2. Enhanced muscle protein synthesis. The low oxygen levels in muscles during BFR increase lactate production, stimulating growth hormone release. Research indicates that BFR training can elevate growth hormone levels by up to 290% post-exercise. 3. Improved recovery and rehabilitation. BFR is widely used in rehabilitation settings to preserve muscle mass and strength in patients recovering from injuries. A clinical trial in 2019 showed that BFR training helped post-ACL surgery patients regain 15% more quadriceps strength compared to traditional therapy alone. 4. Increased VO2 max and endurance. BFR training enhances aerobic capacity. A 2020 study reported a 10% improvement in VO2 max after 6 weeks of BFR walking at just 50% of maximum heart rate. Now, let's compare BFR training with traditional strength training. BFR training provides comparable muscle hypertrophy and strength gains to traditional high-intensity strength training, but with significantly lighter loads. While traditional resistance training relies on lifting weights at 70 to 85% of 1 rep max to stimulate muscle growth, BFR achieves similar results at just 20 to 30% of 1 RM by creating a hypoxic environment that enhances metabolic stress and muscle fiber recruitment. For example, a research demonstrated that BFR training led to a 12% increase in quadriceps size after 6 weeks, comparable to a 13% increase observed in traditional training at high loads. Additionally, BFR minimizes the strain on joints and tendons, making it particularly advantageous for older adults or those recovering from injuries. A study in 2018 found that BFR participants reported 40% less joint discomfort compared to those performing high-load training. Moreover, BFR training induces rapid fatigue due to restricted blood flow, shortening workout duration while still maximizing efficiency. These benefits make BFR a versatile alternative for various populations, from elite athletes seeking performance gains to individuals with physical limitations looking to maintain muscle mass and strength. Although BFR training is highly effective, improper use can lead to complications such as excessive pressure or circulatory issues. To ensure safety, the following guidelines should be followed. 1. Pressure levels. Use 50 to 80% arterial occlusion pressure for the upper limbs and 40 to 60% for the lower limbs. Excessive pressure may lead to nerve damage or circulatory problems. 2. Load intensity. Stick to 20 to 30% of 1 rep max for resistance exercises and low-speed walking for aerobic training. 3. Duration. Limit BFR sessions to 15 to 20 minutes per muscle group. 4. Equipment. Use specialized BFR cuffs with built-in pressure monitors for accurate control. Elastic bands are an alternative, but should be used with caution. BFR training can be applied in various contexts, from sports performance to general fitness. Here are some practical examples. 1. Resistance training. Perform leg extensions, bicep curls, or squats with 20 to 30% of your 1 repetition maximum. Complete 4 sets with a rep scheme of 30, 15, 15, and 15, resting 30 seconds between sets. 2. Aerobic training. Walk on a treadmill at 50% of your maximum heart rate for 15 minutes with BFR cuffs on your thighs. 3. Rehabilitation. Post-surgery patients can use blood flow restriction during low-intensity exercises like seated leg presses to maintain muscle mass and strength. 4. Athletic performance. Sprinters and jumpers can use BFR during light plyometric drills to improve explosive power without heavy loading. 5. Warm-ups. Athletes can incorporate BFR during warm-ups to pre-fatigue muscles and enhance activation for subsequent high-load exercises. BFR training is revolutionizing the way athletes, rehabilitation patients, and fitness enthusiasts approach exercise by enabling significant muscle growth, strength gains, and recovery with minimal loads. It offers a versatile and safer alternative to traditional high-intensity training. However, proper technique, equipment, and supervision are crucial to maximize its benefits and minimize risks. As research continues to explore its applications, BFR training is poised to become a staple in modern exercise science. Whether you're an elite athlete or someone recovering from injury, BFR opens new doors to achieving your fitness goals. If you enjoyed the video, like and subscribe and share your thoughts in the comments. See you in the next one.